Good morning, good afternoon, good evening. Welcome to everyone, ladies, gentlemen, guys, gals, and non-binary pals. I'm Monique Springer, Project Officer with UWIHARP, and I'm joined today with Kelia Anderson, our Project Officer. A very special welcome to our students, staff members, colleagues with the National HIV/AIDS Commission if they're on, our off-campus partners, repeat visitors, and to our new guests. UWIHARP is the HIV Sexual Health Unit at UWI, and we seek to positively influence the sexual and reproductive health and wellness of the university population and the wider Caribbean society. Our primary focus is the development of sexual health literacy among the community through programs such as our digital dialogues. These are sexual health conversations, and they will be held during the semester. They include the S-Files Sexual Health Discussion Series on a wide range of topics, and the Shock Series, which will focus on sexual health issues among our vulnerable Caribbean populations during COVID-19. So you can look out for our flyers on our social media platforms, Facebook, Instagram, the UWI app, and through student UWI emails. There are some participating guidelines. All mics are muted and videos are turned off at this point. Q&A will take place after the presentation and the mics will be unmuted. We ask you to post your questions or comments during the presentation in the chat pod located at the bottom of the screen. We aim to address as many as possible at the end of the presentation. Alternatively, you can message me directly if you prefer. For those questions we couldn't get to, please email them to uwiharp@cavehill.uwi.edu before the end of the day, and we will address them shortly after. The sessions will be recorded, and the recordings will be posted afterwards on our social media platforms, including our YouTube channel, UWIHARP Cave Hill. These will be done without the Q&A to protect participants' confidentiality. Please note that we cannot guarantee confidentiality in this public forum among participants, so be cautious about what personal information you disclose about yourself and others. It is safer to talk in general terms. Please complete the evaluation form that will be sent to you after the session, and you can also suggest topics that you're interested in for us to facilitate for you. There are a few rules. We have some that have been adapted from HIV 2020 online. UWIHARP's digital dialogues provide a safe space to address a range of sexual health topics using a sex-positive approach. We encourage participants to share their knowledge, experiences, and opinions in a respectful manner. You may disagree with views highlighted today. However, please be respectful of other outlooks, regardless of your religious or moral beliefs. Let us be mindful in the way we discuss sensitive topics. UWIHARP operates on a zero tolerance policy for any kind of abusive, discriminatory, belligerent, or disparaging comments or actions that may cause distress to presenters and/or participants. Persons who engage in any undesirable behaviors will be immediately removed from the webinar unannounced. UWIHARP's guiding principle is to first do no harm. And today we have a very exciting topic. We're going to be looking at, the topic is Spotlight on Men's Sexual Health, Mind Your Business. And we will be focusing primarily on cisgendered men. And by that, if you have missed the other presentations, that means those who have been born with a male anatomical sexual anatomy, and which is aligned with their gender identity. So they're born with a male anatomical body, and then they identify as men. We acknowledge that this is not universal, and there are other identities such as transgendered, intersex, non-binary, and multi-spirited individuals that do not conform to the male-female dichotomy. We recognize, we see, and we honor diverse sexual orientation and gender identities. And today, we have a veteran in the field of sexual health, and as a medical educator, is Dr. Elliot Douglin. He's a primary care physician of 45 years experience who believes in the critical importance of primary prevention. He's a health educator and takes special interest in diet and lifestyle and in the biochemistry of evidence-based natural molecules in fighting against the scourge of chronic non-communicable diseases. He's a 1974 honors graduate of UWI. He was a gold medal winner in biochemistry, which he further studied at Leeds University. He does part-time lecturing in biochemistry and clinical chemistry at UWI Medical Sciences faculty. I now invite Dr. Douglin to share his presentation and to begin when he's ready. Dr. Douglin.
Thank you very much, and good morning, good day to everyone. Thanks for this privilege to share with you, and I welcome you all. I'm going to be presenting the subject as a PowerPoint, looking first of all at prostate health, then erectile dysfunction and the issues surrounding that, and then a brief look at sexually transmitted infections in terms of safety. So we're going to begin in a moment, and I hope that the information given will be very good for you in terms of education and being able to share with others. Male sexual health, male prostate health. We're going to begin with the prostate gland because that is a major scourge in our community. For example, prostate cancer is the #1 killer in men in Barbados. If you look back in the period 2002 to 2008, a study done by Professor Hennes showed that death rates, that is mortality rates per year, number of deaths per 100,000. In that period, the range was 63.2 to 101.6 per 100,000. That looks like in the range of 130 to 220 deaths per year. So that is quite a high rate of mortality here in Barbados. In 2018, we have 302 new cases of prostate cancer. And all around the world, especially in the Western world, prostate cancer has been increasing in incidence over the past 4 decades. And much of the research is focusing on the lifestyle changes over the past 50 years that would be linked to such an increase. So it is the #1 cancer killer in men in Barbados, and for most part in the world. Jamaica has a high incidence. Certain areas in Northern Europe, USA, Afro-Americans. So there's a big problem. Just a quick look at the male pelvic anatomy. You see the bladder, and then just beneath the bladder, where the prostate gland is being indicated, it is a gland situated underneath the bladder, and the water tube or urethra passes through it on the way out. So that is why any enlargement of the gland, even if it is benign, can squeeze the urethra and present obstruction to the outflow of urine, urinary obstruction, which can be very painful when acute and very annoying when it is chronic, and a man has to get up several times at night to pass urine. That is the benign prostatic enlargement, which is also a common problem, though not of the same morbidity, mortality, of course, as prostate cancer. The diagram below shows the same. This is the bladder, and right beneath the bladder would be the prostate gland, and that is the urethra or urine tube passing right down there, and behind is the rectum. That is why the doctor can insert the digital gloved finger into the rectum and feel the prostate through the rectum. So what is prostate cancer? It is adenocarcinoma of the prostate gland. It is malignant. It tends to spread locally, tends to spread to lymph nodes in the area, and ultimately its most dreaded spread is to bone, where it can cause severe pain. It can also spread to lungs and liver, but it has a predilection for spread to bone in its advanced stages. It is usually a slow-growing cancer, so if caught early, treatment can be successful for radical cure or even prolonging life. And we're going to be spending some time looking at the importance for men of early detection. There we see the normal prostate in the top diagram, and then a malignant prostate with nodularity, enlargement, and that this would be a rock-hard gland, and the nodules of malignancy inside the gland, but invasive in their nature. The male anatomy again, the bladder, the prostate, the pubic bone in front, then you see the testicle and the vas deferens and the seminal vesicle, and the prostate gland right here beneath the bladder again. Sometimes when the prostate cancer invades, it can invade the seminal vesicle. It can invade the lymph nodes nearby. So let's look at risk factors for prostate cancer, since we're focusing on male sexual health, and this is one of the biggest threats to male sexual health, prostate cancer. Risk factors: age, number one. The older that a person becomes, a male becomes, the more at risk the male will be for prostate cancer. Family history: if a person has a family history of prostate cancer, then that person will be more at risk for the development of the prostate cancer. So if a father, an uncle, a grandfather, that would be a family history that would increase risk. So age, family history, and those are two factors we can't do anything about really. Then the factors that we can deal with: obesity and the metabolic syndrome. Obesity increases the risk for all chronic non-communicable diseases, all of them. High blood pressure, diabetes, stroke, heart attack, all most cancers. And obesity is virtually pandemic in our world today, especially in the Western world. And as we shall see, obesity increases inflammation and it dysregulates the immune system and puts a person at risk for a whole host of problems. Metabolic syndrome is a syndrome in which a person is becoming obese, the blood pressure is inching up, the blood sugar is inching up, although the person is not yet hypertensive or diabetic, and the fat around the waist is also going up. Tobacco and alcohol are also risk factors. And tobacco and alcohol abuse are risk factors for all of the chronic diseases as well, not only prostate cancer. Number 5, high intake of dietary fat, saturated fat, animal fat, trans fats. These are dangerous fats. And in today's world, with fast foods, high fat foods, high sugar foods, these dietary factors are very critically important in causing a whole host of chronic non-communicable diseases and increasing the risk for prostate cancer, breast cancer, colon cancer, pancreatic cancer, for example. High intake of fat. And since 1950, the research has shown that the diet has shifted from natural to more processed, more high dangerous fat content, increasing the risk of all of these diseases, including prostate cancer. And then number 6, diets poor in protective nutrients, highly processed foods, poor in fiber, poor in protective nutrients, rather than eating whole natural food, especially whole plant-based foods. People eat food that is highly processed, ultra-processed, empty of really any good nutrition, that's full of calories, sugars, fats, catering for taste rather than health. So diets poor in protective nutrients, coupled with high dietary intake of fat, tobacco and alcohol, and obesity are major factors, and all of those can be prevented. And then there's the vitamin D connection. Low levels of vitamin D increase the risk of aggressive prostate cancer. Early detection. Well, we still see some men presenting at stage 4 when they present for the first time, which meant they were not getting themselves checked, were not getting the PSA blood test done, were not getting the digital rectal examination done. So let's look at early detection and diagnosis. The PSA blood test, though at one time considered controversial, is a key test. I'll talk about it a little bit from now. The digital rectal examination is also important, but of course, you even want to detect prostate cancer before the doctor can feel anything in the prostate gland, because if you're already feeling a hard nodular gland, the cancer must be considerably advanced, even though still local. You want to pick it up before you can feel anything on the digital rectal examination, although the digital rectal examination is important. Then there are exotic tests, highly advanced tests and expensive tests that are not available here. The prostate health index blood test. And then there is a DNA, RNA test in the urine. These have not reached the Caribbean yet. They are also available scarcely in some countries. They're expensive. There's the transrectal ultrasound, which the urologist will use to assess the gland more carefully in terms of size and foci of malignancy. And then in some countries, there's the high-tech specific MRI 3 imaging, 3-dimension imaging, which is also very expensive and high-tech, available in some countries, not yet available here. And the ultimate test, of course, is the biopsy. The ultimate proof that there is cancer there is the biopsy. Biopsy is not pleasant, but it is the only way to ultimately prove. So the PSA blood test, digital rectal examination, biopsy, transrectal ultrasound. The others in brackets are high-tech, expensive, not yet available in our part of the world. So the digital rectal examination, the doctor inserts the gloved index finger into the rectum, and you see the prostate is just in front of the rectum, so he can feel any nodularity, hardness, or increase in size by the finger inserted into the rectum. Some men consider it unpleasant and shy away from getting the test done, but the ladies have to get their pap smears, so the male should not shy away from the digital rectal. And of course, coupled with the PSA, looking to use early detection as a means of detecting any change early enough that it can be curable. The PSA is a blood test. And looking at the PSA, the normal range is 0 to 4 nanograms per ml, but can be higher in some normal men. And the PSA may be bound to other proteins, or it may be unbound or free. We'll come back to that in a minute. But it is not just looking at a single value of the PSA. It is looking at how fast the PSA may be moving, the PSA velocity. In other words, a man may have a PSA of 0.1, which is perfectly, beautifully normal. But if in a quick time it has gone to 0.2, that means it has doubled fairly quickly. And although still within the normal range, it is the speed at which it is moving that would now cause the urologist or the doctor to be of concern. So the PSA velocity, how fast it is rising, is actually more important than just a single value. Then there's the PSA density, that is the PSA level divided by the volume of the prostate gland. And when you divide the PSA level by the volume, you get what is called a PSA density. So a large gland that may be large because it is benign enlargement, there may be an elevated PSA that is of no significance in terms of cancer, and the PSA density helps to distinguish between a PSA that is elevated because of a large benign gland and a PSA that is elevated in a smaller gland because malignant change has begun. Then there is the free PSA. If the total PSA, as we mentioned first, is moderately elevated and the percentage of free PSA is low, the urologist would be more inclined to do a biopsy, because a low free PSA within the context of a moderately elevated PSA indicates that there is a greater risk for malignancy being the cause of the elevated PSA. So we recommend that men get a PSA blood test every year or two, beginning at age 45. If there's a family history, beginning at 40, age 45, and look not only at the absolute value, but at the rate of change. And I know a gentleman who told me that he had a PSA done at a particular time, and it was beautifully normal. And although told to check every year or two, he allowed 3.5 years to pass. And when he went back for a check, there was a surprisingly abnormal change. So it is important for the PSA to be checked every year or two to follow what is happening. And the digital rectal examination every year or two, that can be less frequent. Because early detection is important, if the prostate cancer is detected very early, treatments can be effective for cure or tremendous prolongation of life. The transrectal ultrasound is done by the specialist, and sound waves are used to create a three-dimensional video image of the prostate gland and look for any nodular or other changes that indicate malignancy. So treatment options for prostate cancer depends on age and on the stage. For example, the way you would approach prostate cancer in a man who's age 85 would be nowhere as aggressive as how the doctor, the urologist, would approach treatment of prostate cancer in a man age 49, 50, or 51. Because the younger a person is, the more aggressive these prostate cancers tend to be. In older men, they tend to be less aggressive, and the patient may die with the prostate cancer rather than from the prostate cancer. So treatment depends on age, depends on stage. And when the doctor and the urologist catches prostate cancer very early, there's a great chance for complete cure. The best treatment is the radical surgical removal of the gland when caught early. Take the gland out, radical prostatectomy. Other options available are brachytherapy, where radioactive pellets are thrown into the gland and act for a period of 6 to 8 to 12 weeks locally to kill the prostate cancer. Brachytherapy. There's also linear radiotherapy. And then there is hormone manipulation, androgen deprivation therapy, where drugs are given to block the androgen or testosterone receptors, because prostate gland is driven, stimulated to grow by testosterone and testosterone-like hormones called androgens. So androgen deprivation therapy blocks the drive that the testosterone gives to the gland by blocking the receptors. Chemotherapy is also available for advanced disease, and now we've understand that when the prostate cancer becomes resistant to androgen deprivation therapy, research has now shown that the prostate cancer can begin to make its own testosterone. You see how deviously molecularly smart these cancer cells can be. So they've developed a new drug called abiraterone, which can block testosterone or androgen synthesis, even in the prostate cancer that is trying to make its own testosterone. This drug is new, it is very expensive, and it has been shown to, in advanced cases, to prolong life. So you want to catch the prostate cancer early when radical removal of the gland can be curative. If there's the option for brachytherapy, that can also work very well if the cancer is caught early. Hormone manipulation and the other options there tend to be less lastingly effective. So you want to catch the cancer early so that radical surgical removal, which is the best option when caught early, or brachytherapy, which some suggest can be an alternative to radical surgical removal, although all the experts don't agree there. You want to catch the prostate cancer early, so early detection is key. So let's move now from early detection, which is very important. Our men should know they should check with their primary care physician, get a blood PSA done every year or two, watch that PSA, get a digital rectal, make sure everything is all right, and check regularly, because you may miss a few years, and when you check back, the news may not be good. But checking frequently, any early change can be monitored by your primary care physician, and you can be referred to your urologist for further opinion, for watchful waiting, or if the evidence indicates, transrectal ultrasound and a biopsy. So early detection is key, and this means educating our men to go to the doctor and ask the doctor for a PSA blood test to be ordered and for the digital rectal to be done. The PSA blood test every year or two, especially if there's a family history, and especially if you're at risk: obesity, diabetes, smoking, alcohol, unhealthy diet. These things put a man at risk. If there's this risk, needs to be even more careful in monitoring that PSA and see how it is moving, as we said earlier. But basic principles of prevention: avoid dangerous fats, eat low-fat, high-fiber foods, eating a whole, natural, plant-based diet is of best protection against all the chronic non-communicable diseases. Minimize or avoid red meat, because red meat is inflammatory. Exercise has been shown to reduce the risk of all the chronic diseases, including prostate cancer and breast cancer, just to throw in that for the ladies. Avoid obesity. Obesity increases the risk of prostate cancer, colon cancer, breast cancer, pancreatic cancer, ovarian cancer, uterine cancer. So avoiding obesity means eating less, exercising more, intermittent fasting, avoiding the fast food stuff and the processed stuff. If people eat whole, natural food, obesity will be much less of a problem. But it's the highly processed carbohydrates and dangerous fats and sugars, high sugar diets, high sugar drinks, and sugar in everything that is driving the obesity pandemic around the world. Avoid tobacco and alcohol. They increase the risk of prostate cancer, other cancers, and all chronic diseases. Eat more fruit and veg, an abundance of green leafy vegetables, certain seeds and nuts we'll mention a little later on. And now the research is showing that for all these chronic diseases, and certainly now with the COVID-19 pandemic, optimal levels of vitamin D in the blood. Vitamin D is so important for the immune system and for reducing one's risk of prostate cancer in a man, breast cancer in a woman, colon cancer in both genders. So these are principles of prevention, and I always like to stress primary prevention. Early detection is key, and when you couple early detection with educating people how to follow a preventative lifestyle, you're waging more effective warfare against all of the chronic diseases, including prostate cancer. Other principles of prevention: antioxidant high diets, the carotenes, beta carotene and alpha carotene in your green leafy vegetables, carrots, yellow and orange colored fruits. Dark green leafy vegetables are so protective, so healing, and we eat so few of them. People just concentrate on starch and a protein, rice and stew. But the green leafy vegetables and the salads are so important. Green leafy vegetables are so healing, so protective. And in the Western world, most people eat so few of them. Yellow or red vegetables and fruits. And then just to focus on lycopene for a minute, lycopene from tomato products, red watermelon, red guava, apricots, pink grapefruit. Of course, the most famous source of lycopene that people know will be tomato products. Lycopene is a wonderful protector of the prostate gland, and the higher the intake of lycopene, the greater the protection, not only of the prostate gland, but of breast, lung, colon, liver. Lycopene is a wonderful carotenoid, and it is a powerful antioxidant. And when the tomato product is processed, like tomato paste, it is even more available. It also helps to protect against cardiovascular disease. So again, eating more tomatoes, eating more fruits and vegetables of color. The color indicates antioxidants, and antioxidants reduce free radical attack and reduce inflammation and protect against all the chronic diseases, not just prostate cancer. So I'm not going to spend a lot of time here on the lycopene. It is an open chain unsaturated carotene, imparts the red color to tomatoes, guava, rosette, watermelon, and pink grapefruit. Those are other sources. A lot of studies done on it. It is a proven antioxidant. It neutralizes free radicals, and it is taken up by the liver, the colon, the rectum, the prostate, the pancreas, and the breast, and it exerts wonderful protection in those organs against inflammation and cancer. And lycopene is absorbed more efficiently if it is processed into juice, sauce, or paste. A little good vegetable oil like extra virgin olive oil will enhance absorption, or eating some nuts with it. But lycopene absorption is enhanced with some fat. Eat a few almonds, or better yet, walnuts with it, or a little olive oil. In the body, it is deposited in those organs there I've mentioned already: lungs, liver, prostate gland, colon, and skin. And its concentration in body tissues tend to be higher than all the other carotenes. In other words, it is stored in the body tissues better than beta carotene or alpha carotene or the others, although they tend to all work in synergy. So regular high consumption of fruits and vegetables is recommended as a part of healthy eating for the prevention and against all the chronic diseases, which are so such a scourge in today's modern world. More fruits and vegetables, whole, natural, plant-based foods, cutting down on salt, avoiding the sugar and the sugary drinks and sugary things, and eating naturally and simply and whole. And better to eat what is made by the creator rather than what is made in a factory. The ultra-processed foods of this generation have now been shown. For example, research shows that 11 million deaths every year are caused by unhealthy diet. That is more than tobacco and alcohol and physical inactivity combined. Imagine that unhealthy eating causes 11 million deaths a year. But that's far worse than COVID. And people that weren't taking stock. So eating rubbish, to be bluntly harsh, is the scourge of this modern generation, just eating for taste and not eating for health and protection. And epidemiological studies have shown that the high intake of lycopene-containing vegetables is inversely related to the incidence of all types of cancer, and the carotenes then and the other polyphenols in vegetables. We come to another important one that has a lot of evidence behind it. Studies show that grapeseed extract, the extract of grape seeds, which is a cheap supplement available, is a powerful chemo prevention against prostate cancer and colon cancer. Comes as a 100 or 200 milligram capsule, and it is a very good health investment. Persons can take up to 400, 500 milligrams of grapeseed extract a day. Powerful, within the context of a healthy lifestyle, of course, powerful protection of the colon, powerful protection of the rectum, powerful protection of the prostate gland, as well as being good for the arteries and the cardiovascular system. Grapeseed extract. Green tea polyphenols. Decaffeinated green tea contains polyphenols that are highly protective of all the organs, including the prostate. And the decaffeinated green tea polyphenols work synergistically with vitamin E and grapeseed extract, for example, and green leafy vegetables and carotenes like lycopene. Now we come to walnuts. I know in Barbados we like our peanuts, but the research is showing that the walnut is really the #1 nut. Walnuts are rich in omega-3, but more importantly, they are rich in very important antioxidants and other essential fats that reduce inflammation. And research is showing that walnuts actually, even in a person with prostate cancer, actually reduce mortality from the disease. They help to reduce insulin resistance, and insulin resistance means the body has to produce more insulin to get the insulin's job done, and that higher production of insulin drives all cancers, including prostate cancer. So cutting out the sugar, exercising, keeping slim and trim, eating more vegetables, reduces insulin resistance. Walnuts also help to reduce insulin resistance. Walnuts are powerfully anti-inflammatory. It is a very good protective nut, walnuts. Other principles of prevention as we move on are vitamin D3. I'll come back to that in a moment. Vitamin E, especially the gamma vitamin E, selenium, vitamin C, and zinc. All of these improve antioxidant power in the blood, reduce inflammation, and help to promote good health and help to prevent and reduce the risk for all of the chronic non-communicable diseases, not only prostate cancer. Vitamin D3, a bit about that this vitamin continues to be the subject of much research. Studies indicate that it is a powerful enhancer of the immune system. It is powerfully anti-inflammatory, and it is a powerful cancer-preventing agent. It is anti-proliferative. In other words, it inhibits any wildness in cells wanting to go wild and multiply as if they don't care to obey any biological law. Vitamin D is an enhancer of the immune system. It is powerfully anti-inflammatory, and it is an anti-proliferative agent. And thousands of papers have been published showing the importance of vitamin D. In fact, it reduces the risk of all the chronic non-communicable diseases. We now know from studies that 42% of tested populations are deficient in vitamin D. And there's no sense saying that in Barbados we have a lot of sunlight, because people work in air-conditioned rooms, people work in offices. Even people who cut canes and you think they're in the sunlight, they have on a lot of clothes to prevent centipede stings and the blades from cutting them, and they don't get any sunlight. So almost half of populations are vitamin D deficient. And although blood levels between 20 and 50 nanograms per ml are considered adequate, most experts suggest going up to 80 nanograms per ml would confer massive protection against all chronic diseases, including 19 different cancers. And you can check that out. It is the evidence is amazing. One study, though, reported by Dr. Bruce Hollis of the Medical University of South Carolina, and you can look that up yourself, showed that given men with low-grade prostate cancer 4,000 units a day of vitamin D for a year, showed a reduction in the number of cancer-positive core samples on repeat biopsy, even though the PSA levels didn't change much. So in other words, the men who took the vitamin D, even although the PSA didn't show much change, when they repeated the biopsy a year after, the number of segments showing cancer was, the number was considerably reduced. And that was a presentation by Dr. Bruce Hollis. So taking 4,000 to 5,000 units daily of vitamin D is a very cost-effective way of reducing the risk of developing aggressive prostate cancer and of protecting against a whole host of chronic non-communicable diseases, including breast cancer, colon cancer, pancreas cancer, cardiovascular disease, neurodegenerative disease, and enabling your immune system to be strong enough that even if COVID should pass, you can battle it without severity. That's how important vitamin D is. The role of inflammation. Inflammation drives prostate cancer. Red meat is inflammatory. Excess omega-6 oils, like frying in corn oils and frying repeatedly in the same oils, using the same oils over and over again. That's the danger of the fast food industry. When they buy a whole set of oil, they're not going to fry in it once. And repeatedly frying in these omega-6 oils create inflammation. Abdominal obesity, which is quite rampant, is a source of not only inflammation, but hormone disruption in the body. A man, for example, with a lot of abdominal fat may actually produce more estrogen than his wife. And that is, you know what that means. So abdominal obesity creates inflammation and increases the risk of all the chronic non-communicable diseases, including prostate cancer. The anti-inflammatory lifestyle, therefore, is the protective lifestyle. Less animal products and saturated fat, eat more whole, natural, plant-based foods, avoid sugar and refined processed carbohydrate, eat high fiber foods. And there are certain old-time herbs that the ancients used to use, which research is now showing that these herbs are highly anti-inflammatory. Ginger. Now, when it comes to curcumin from turmeric, so many studies have been done showing the powerful antioxidant, anti-inflammatory power of curcumin, the turmeric extract, to reduce the risk for all cancers and chronic non-communicable disease. We can use more of these cheap herbs in our cooking rather than so much salt and oil. Use more of these flavorful herbs, rosemary, nettle, cat's claw, but curcumin is ranked as the #1 spice for antioxidant, anti-inflammatory health. So important it is. Moving on, omega-3 oils protect the prostate. That is omega-3 from flax, walnuts, omega-3 from the fish oils, pumpkin seeds, walnuts, flax, protective of the prostate as well. And these are whole natural plant-based foods. The protective role of lignans. Lignans are important plant nutrients found in legumes and grains. For example, flax, soybeans, garbanzos, barley, lentils, and sesame seeds. And these lignans are changed into enterolactones in the intestines, and enterolactones modulate the impact of hormones on tissues such as breast and prostate, and therefore mitigate against excessive hormone stimulation. Cruciferous vegetables, cabbage, broccoli, cauliflower, Brussels sprouts, watercress, radishes. All of the cruciferous vegetables are powerfully protective against prostate cancer, breast cancer, colon cancer, and chronic diseases. And we need to eat more of these things, more cabbage, purple cabbage, green cabbage, more broccoli. Eat them raw, eat them very lightly steamed, extremely good for the health. Instead of people buying a whole host of animal fat and fried, oily, greasy stuff and talking about taste, we need to get back to nature and eat more whole, natural, protective food, because the scourge of the chronic non-communicable diseases, which includes prostate cancer, that scourge is continuing to wreak havoc around the world. These cruciferous vegetables contain indole 3-carbinol and diindolyl methyl, and they are highly protective of prostate in men and breast in our women. Isoflavones. Research has shown that men who drink soya milk, we call it soya milk, soya beverage, in the place of animal milk, will reduce the risk of prostate cancer. Soya isoflavones are antioxidants and modulators of sex hormone receptors. Isoflavones found in chickpeas, red clover, soy, reduce the risk of prostate cancer. I give you a source there, which look at a meta-analysis of randomized controlled trials. Right there it is. You can look it up. and you see the number of papers showing the impact of isoflavones on prostate cancer risk reduction in men. More recent research shows the value of pomegranate juice and the pomegranate extract containing putinic collagens and ellagic acid. They help to lower PSA and protect the prostate, antioxidant power, anti-inflammatory. Garlic, aged garlic extract, powerful antioxidants and anti-inflammatory cells as well. All of those ancient good whole foods, garlic and clove and ginger and turmeric, good herbs to use within the context of a healthy diet. Certain essential oils have been looked at. Boswellia is powerfully anti-inflammatory. Boswellia, the alpha keto beta boswellic acid, very good for reducing inflammation, available both as an essential oil and as extracts, black seed oil, pomegranate seed oils. A lot of research being done on pomegranate seed oil over in Israel. Even in our local setting, a weed called Guinea hen weed by the Jamaicans, Galiroot by the Barbadians, Anamu by the Spanish, which was used as a tea in the ancient times, which we have forgotten a lot about, has been shown by researchers in Maryland University and University of the West Indies to be helpful in helping to reduce the risk of these diseases. And so is guava leaf and soursop leaf, research being done on those as well. But you can't beat the importance of the protective lifestyle. But let's move on now to erectile dysfunction, as time has a way of moving on. Well, when it comes to men, we should know, men should understand that the penis is the barometer of endothelial health. If your blood vessels are not healthy, the penis will pick it up early, because erection depends on blood flow to the spongiform tissue in the penis. And anything that lessens the vigor of blood flow is going to interfere with erectile function. And if there is arterial disease, the inner lining of the arteries, called the endothelium, bears the brunt of the metabolic syndrome as men put on weight around their tummy, as men eat unhealthily, as sugar and blood pressure and triglycerides and cholesterol all inch up. Then the inner lining of the arteries, called the endothelium, becomes affected, and poor endothelial health is going to lead to dysregulation in terms of blood pressure. The endothelium is going to become more sticky, hence the process of atherosclerosis will begin, blood flow will be reduced, and that is why we say the penis is the barometer of endothelial health. Erectile dysfunction is a mirror of cardiovascular risk. Erectile dysfunction equals endothelial dysfunction. So that is an important thing to understand. And as a matter of fact, as we shall see in a minute, because we have to press on, an elderly male with erectile dysfunction, that may be a signal, a risk that the person is at risk for heart attack, stroke, peripheral artery disease, or some cardiovascular disaster. So it is not to be taken lightly. So the definition: erectile dysfunction is the consistent inability of a man to get or keep an erection satisfactory for sexual intercourse. Under the age of 45, it affects 3% of men. The incidence increases to 25% by the age of 65. By the age of 75, almost 2/3 of men may have erectile dysfunction. 1/3 of all men over 65 would suffer from erectile dysfunction at some point in time, and half of men over 70 may suffer from erectile dysfunction. Erectile dysfunction, what causes it? Aging, we just mentioned, obesity, smoking and alcohol excess. So important for men to care themselves by avoiding tobacco and avoiding alcohol. Hyperhomocystinemia. Homocysteine is a molecule which, if it accumulates in the blood vessels, causes the blood vessels to become inflamed. Adequate vitamin B6, folic acid, and B12 help to reduce the risk of excessive homocysteine, along with exercise, keeping slim and trim, and eating an abundance of green leafy vegetables. Vitamin D also helps to reduce the tendency to elevated homocysteine levels. Hyperlipidemia, too much cholesterol or triglycerides in the blood, which will interfere with the endothelium. That is a risk factor for erectile dysfunction. High blood pressure and or the medications used to treat it can be a cause of erectile dysfunction. Diabetes and other chronic non-communicable diseases impact on blood flow to the penis, impact on blood flow to the coronary arteries. And of course, prostate surgery and after prostate surgery or pelvic surgery, interfering with the nerves there or the blood supply there, can also cause erectile dysfunction. A very important cause, especially in younger men, would be stress, anxiety, depression, and relationship problems. Sleep disorders also impact on erectile function. If men are not getting enough sleep, if they're stressed, anxious, depressed, if they're afraid of how they may perform, if they're afraid in the particular relationship, all of those psychogenic factors can turn the sexual process off at the level of the mind when there may be nothing wrong physically, showing how important these psychological factors are. Drug use and abuse. Abuse of any drug, alcohol, tobacco, marijuana, the other so-called relaxation drugs that young people may go experimenting with, all of them can cause erectile dysfunction and can cause danger and damage to the body as a whole. Pelvic trauma and pelvic surgery we mentioned already. So those are the causes of erectile dysfunction. Now, just to put it in summary, in younger men, erectile dysfunction is most likely to be psychogenic in a young, healthy man. Although we have a lot of young men nowadays with huge tummies, blood pressure going up, cholesterol going up, they're young but not healthy, and therefore they can have pathological erectile dysfunction as well. But in young, healthy men, it is most likely to be psychogenic, requiring a careful history, counseling to find out what may be the problem that is the stress, and it can be resolved with careful counseling and so on. In older men, erectile dysfunction is more likely to be pathological, related to diabetes, hypertension, drug treatment, atherosclerosis, and then that it is a serious marker of cardiovascular ill health. Blood flow to the penis is key to erectile function and depends on the brain, the spinal cord, parasympathetic nerves, arterial blood supply, and testosterone levels. All of those are important factors in good sexual health. Getting back to endothelial function, the inner lining of the arteries, called the endothelium, that is such an important organ, although we don't look at it as an organ. The endothelium produces nitric oxide, and nitric oxide is made by the endothelial cells from two amino acids, arginine and citrulline, which we know of in the urea cycle in the liver, but which are also important in the endothelium, the inner lining of arteries, to keep the inner lining healthy. Nitric oxide keeps the blood pressure nice and normal, improves blood flow, keeps the inner lining of arteries healthy and with good functional integrity, helping to prevent the development, the first start of atherosclerosis. So when your endothelial health is good, your cardiovascular system is going to be good. When the endothelial health begins to decline, coronary artery disease, stroke, and all the other things can occur, and poor blood flow to the penis. Research has shown that supplementing with arginine and citrulline can improve blood pressure and also improve blood flow to the penis, the brain, and the lower limbs. So good endothelial function means good erectile function. Healthy living, healthy diet, adequate sleep, coping with stress, no tobacco, no alcohol, regular moderate exercise, eating healthy food, maintaining good blood flow. Treatment of erectile dysfunction, medications that are used, the phosphodiesterase inhibitors like Viagra, sildenafil, and Cialis, tadalafil, commonly used. A man who uses these should use them under the supervision of a medical practitioner, especially if he's on other drugs, because if you take these while you are on organic nitrates for angina or other heart conditions, you may get a profound fall in blood pressure. So a man shouldn't go and take these, especially if he's on medication for cardiovascular disease, without his doctor's supervision, input, and advice. Other medications used to treat erectile dysfunction, prostaglandin vasodilators like alprostadil, which has to be given by injection into the penis, rather awkward, or better yet though, a urethral pellet inserted into the urethra, but that is also uncomfortable. In some cases, men may need increased levels of testosterone and would have to be given testosterone. And then in some cases, there are mechanical devices such as vacuum pumps to draw blood into the penis to maintain an erection. These are the options
sorry to interrupt you, Dr. Douglin, but it is 10 o'clock.
Okay.
So I'm wondering if we can fast track to the, I know it's the next slide or thereafter.
Yes, okay. Yes.
Yeah, if you wouldn't mind, thank you.
Right, so treatment, talk therapy, counseling, psychotherapy, certain pelvic floor exercises help. And then just a quick look at the STIs. Chlamydia is the most common bacterial STI. Young men and women may have it and not know and spread it. Gonorrhea, that presents with burning and inflammation. Syphilis, much less common than before, but still there. Herpes, hepatitis B, HIV. And the message here really is to practice safe sex, abstinence, faithfulness to one partner, proper condom use, and regular medical checks if at risk. Okay, well, thank you. We had a lot to cover in that short time, but open up now for any sharing or questions for no more than about 10 minutes. I hope that the information would be of value to you in terms of prostate protection, prostate health in men, erectile dysfunction, understanding it in men, and so on. Thank you. Over to you, Monique.
Great, thank you so much, Dr. Douglin. That was very, very informative and really a lot of good information. Of course, you know, I particularly like the natural-based treatments and therapies. You insist on evidence-based, but you know, that's my preference. So just a couple of takeaways, you know, I would like to highlight before we open the floor. And I think particularly for our population at the university, especially among young males, and hopefully when we post this on our social media platforms, they'll be able to access it. Some things to think about, especially where they'll be very concerned around erectile dysfunction, the consumption of alcohol and recreational drugs and so on. Especially also lifestyle factors like stress with exams, with schoolwork, for those who are working as well, combined stress of working and studying, and those with families. So just to highlight, maybe those are some things that they may want to think about that may impact on their sexual health.